in our Innersight program, we focus mainly on basically only on screening for skin cancer.
Mm.
We don't spend that much time on the other factors of skincare as such, but our focus is on longevity. And that's one of the things that we do is see who we need to screen for skin cancer. And I think we can starting with the skin cancers, and then we can take it from there. So the way we do it in our practice at the moment is questionnaire based. So we ask a couple of questions on the online questionnaire that they fill in to see if there's an increased risk. And then those patients, we then advise that they might need to see you.
Mm. Yeah, fair enough. So I usually advise my patients when they ask when should they have a skin screening. So I think every single person should have at least a yearly screening. Whether that is with your GP as your first point of contact, you should be undressing in front of your GP that you trust so that they can have a full skin check of your entire skin surface. And that includes palms of the hands, soles of the feet, that includes your scalp, your whole face, everywhere. If there is anything that is picked up, then obviously that can be referred to a dermatologist. And a lot of people prefer to just straightforward from the beginning go to a dermatologist because often in your GP consultation there's not that much time for you to do a full skin check. It takes a little bit of time, and you have to be really thorough with it. So I would kind of divide it into 2 age groups. I usually say to people, wait until your child goes through puberty. That's usually a time where your child will need a skin check for their facial skin. Maybe they're getting hormonal acne. A lot of their nevi or early moles will be already visible on the skin. They can still grow and change. Before that age, if you have a child that has one specific very dark mole that you notice is maybe growing or that you're very worried about, that can be checked. But then after puberty, I would say a yearly check. If it's low risk, I will often tell some of my patients every 2 years is fine if you really have very few moles, but most people will need a yearly or every second year check. And then obviously, then we go differently in terms of separate from age, your higher risk patients. And I think then when once I have a relationship with a patient, then that patient has had something, either pre-cancerous or cancerous lesions, that definitely changes your follow-up. So patients with pre-cancerous lesions that I'm following up, I will want to see every 6 months. The moment you've had a primary skin cancer for the first time, your follow-up changes to every 3 to 4 months, at least for the first 1 to 2 years. Thereafter, if nothing new is diagnosed on histology, I will then slowly make your follow-ups longer and longer until maybe we're doing yearly again, as long as there's been nothing new in that year. So definitely structured to different patients and different risk profiles.